A lot of people get hair transplants done, and one question bothers them always. Do I really need to use minoxidil? If at all, if I use, how many years or how many days I have to use? Because people have a fear that drug is something you have to use for the rest of life. That really makes them uncomfortable, and a lot of people don't even start it. Even if they start it, they're going to end it. So we'll just dive into the facts today. There's no other drug in the world today which is comparable to minoxidil. This is quite relevant in post-transplant patients. You look at a transplant, so what we are doing, we are essentially taking a good donor or good hairs from the scalp, from the posterior scalp or beard, and we are putting into the area. No matter what, we are not going to give a complete replacement of all the hairs. So it's very much essential to sustain the existing hair with the only medication what we have is minoxidil, and another medication is finasteride. So a lot of people have a misconception of finasteride that I'm going to discuss in another video, but minoxidil is something you can safely use, and it doesn't have anything to do with the sperm count or sexual libido, which a lot of people are apprehensive about. When someone's starting minoxidil, at least give a commitment of 24 months. If someone asks me how much minimum time frame I can use, because by then your baldness come to stability and most of the roots we transplanted will thrive well, and after that your doctor, whoever is treating you, might give some alternative things, which is like Redensyl or Procapil. So they does similar job to minoxidil, but not as comparable as it, but at least a 60 to 70% of minoxidil job. And the trick is here, the very important thing, you should never stop minoxidil all of a sudden, which is going to get really penalized, and you are going to lose a lot of rebound hair loss. That is the reason, whenever you're stopping minoxidil, take a doctor's consultation, take slowly. Let's say you're using 7 days, come to 6 days, 5 days, 4 days. Every week you can step one do, and maybe 2-3 days a week you can continue for some time. Meanwhile, start replacing those empty days with the alternative medication. So let body get used for the absence of minoxidil and get adjusted newer molecules and newer drugs. So if someone is really particular about not using minoxidil, then you better don't start it. Let's start something like a Redensyl or Procapil based, a peptide based lotion, which is again you can use for 5 to 7 days. But even then, at least use the medication for 1 year. So whenever you're using any of these medications, think that you're doing hair care. They're not medicines. You're not consuming anything orally. If anyone is really having a irritability and allergic to minoxidil, now we have oral formulations, so which is around 2.5 mg and 5 mg. They are also quite effective medications which hardly have any side effects. So if people are apprehensive about any of these medications, as we discussed, we can go for other formulations too. So doctors, finally, my take on this is, given the choice, minoxidil is still the best choice for all the post-transplant patients. If you're not really comfortable, then you can talk to your doctor and go for alternatives.